So welcome everybody, and thank you for attending today. As I've said in the past, we have over 400 registrations here to listen and support our 10 finalists. So my name is Hiam Nadel, and I am one of the organizers and president-elect of SONCL and director for the Center of Innovation and Care Delivery at Mass General Hospital in Boston. Next slide. So today we are having our first Pitch-A-Thon, and it is sponsored by Johnson & Johnson, Microsoft, SONCL, in collaboration with First Responders First, all in well-being for healthcare. So you can see the agenda today, and we are in the opening remarks. We will have several of the teams pitch their idea, and then we will have a break at 4:45 for 10 minutes. We ask that you come back promptly at 4:55. We'll listen to the remaining pitches and then have another break at 5:55 to 6:30. This will be the time that the judges will deliberate, and then please be back promptly at 6:30. We have a very, very special performance for you. After the performance, then the awardees will be presented. Next, so why are we doing this Pitch-A-Thon? So we all know that the patient volume continues to increase. Patients are getting sicker and complex. And we are more and more unprecedented burnout. And we also know we're facing an unprecedented shortage of staffing. So this impacts us very acutely today, but we are worried about the future because it could have catastrophic results. Next slide. So, but we also know that people that are deeply living the problem or are the closest to the problem have the best solutions. So I'm hopeful because we've created a table for you and brought you a seat at that table to help solve the most pressing issues. We have asked our nurse-led teams to focus on 4 evidence-based areas. Adjust expectations because these are non-normal times. Get rid of the stupid stuff. What gets in our way is barriers to just taking care of our patients and getting through our day. We wanted to hear ideas and solutions around radical shoring up of staffing. And then, of course, the last bucket, which is EAP, is not enough. Next slide. But first, I want to thank all our volunteers because none of this would have happened without them. To all our reviewers, I know it was a very, very complicated, process to go through since there were so many good ideas. Our pitch coaches that helped each team, our mentors, and our special workshop guests, Drexel University, and David Murphy and the Kind Tread team. And I want to personally give out a shout out to Eileen Quilty of Johnson & Johnson, Nico Shazi, who is our executive director of SONCL, and Marion Leary of UPenn Medicine, who did incredible work behind the scenes to get us all through to this. And then the next slide, please. So you will hear directly from our organizers and how supportive and how passionate they are about this very issue of bringing nurses to innovate and solve healthcare problems. Rebecca?
Thank you, Hiam. My name is Rebecca Love. I am the current president of SONCL, which we founded in 2019 in an effort to redefine what nursing looked like to the world. As soon as the organization founded, 6 months later, COVID hit. And in that time, we started to organize meetups with nurses around the world as they were heading into their shifts, leaving their shifts, on their shifts. And we recognized that they were innovating on the front line when everybody else fled. And it was that time in April 2022 that I reached out to Molly McCarthy at Microsoft and Linda Benton at J&J And I said, we have nurses innovating out there on the front lines with COVID when everything around them is failing and everything we knew that we thought we knew was not working. And I said, we need to have a hackathon. And both Molly and Linda and their organizations, Kathleen, everyone came together to organize a series of 4 hackathons that we ran over the span of 2 years with regards to COVID. You know, success of an organization happens when you are able to build upon something that is so powerful that it leads to a moment in an evolution like this, where you have an organization like Microsoft and J&J and first responders and All In to evolve this into a pitch event that came out of hackathons in an effort to find those institutions who are going to invest in nursing to be leaders and transform the future of healthcare and make sure that nurses have a seat at the table. One of the most exciting things for me with SONSIEL is that after 3 years of building only a dream, all of us volunteering our time, Marian and Hiam and so many of our board members behind the scenes, SONSIEL reached a place that allowed us to hire our first executive director, Nico Shashi, who you've all had the pleasure of meeting. And in one of the greatest congratulatory moments of what I think is this organization history, Hiam Nadell agreed to come on as the next president to scale SONSIEL forward into that next period of time. As we all transition in our lives, I don't think there can be a greater period of time of accomplishment when you look that you started to build something, others heard you, embraced it, and are moving forward what potentially I see as the biggest promise for our profession. So I'm going to move on to our next slide because I hope you'll join us at SONSIEL because we do a lot of really exciting work together. We really fundamentally believe a rising tide raises all boats, and that if nurses came together and championed each other forward, we could change the face of healthcare. So if you would like to meet us, Marian, Hiam, Julia Cuneo, Nancy Nager, Peter, all these incredible nurses, we are going to kick off our first chapter in Canada. Mary Lou is all going to be happening at the Think Conference, November 4th and 5th in Niagara Falls. We would love you to come and join us because we are not only taking on this issue, we're taking on several new issues and think tanks that are going to come out of that to move us forward. If you would like to be a guest, we've launched the SONSIEL podcast as a way to elevate the voice of both the frontline nurses to the most experienced nurses that are out there, because we believe that all nurses deserve to be heard. So if you'll join us, please come and meet Hiam, please come and write out to us. We would love to have it. And more importantly, buy the book that we wrote. I remember when we approached Springer and Springer said, we've never had a book with 63 authors. You can't possibly do that. And in the course of 4 months, we had all of the authors write their stories in 3-page excerpts that talk about what they did to impact healthcare. So the truth is, we hope you'll join us. But more importantly, please welcome nurses into the future of healthcare. Find them a seat at the table, and together, let's stabilize, scale, and empower the nursing profession to be greater than it has ever been before. So I'm so excited. I am now going to turn this over to Microsoft. I'm going to turn it over to Kathleen. And so congratulations to all being here today. You should all feel so proud.
Thank you, Rebecca. I really appreciate that. I'm Kathleen McGraw. I'm the Chief Nursing Information Officer. We at Microsoft realize that workforce crisis and burnout is significant. Actually, the issue isn't burnout so much as moral distress and moral injury that our providers are suffering right now. Burnout, burden, stress, anxiety, sleeplessness, those are all symptoms of the illness, which is moral distress and moral injury. And that's really why we're so concerned. We just want to say the root cause of burnout is the workplace, not the worker. Our workers are highly resilient individuals, and we need to help them through technology to realize that that resilience can be given back to them, and they can actually receive joy in their workplaces, which is why we all went into nursing, why we went into clinical, why we wanted to help patients. We have developed 6 pillars that we work through, and you can see them here. Addressing work overload. We know that cognitive overload is a huge problem within clinical care. There are so many tons of data that are coming at our providers. How do we help them make sense of that data? Adjusting to new models of care, we're seeing this huge move forward within telehealth, virtual health. How do we leverage the experienced staff that we have to be resilient and to help them help the younger staff that we have or the lesser experienced staff that we have? Improving rewards and recognition. The studies show that recognition is actually more important than rewards. We want to ensure that we expand, enhance our nursing community. As Rebecca had even mentioned around SONCL, that's a huge opportunity to enhance the community within nursing and nurse innovators, improving equity and fairness, and then building a culture of well-being. So I'm going to go ahead and hand it over. I just wanted to make a mention that we need to ensure that we take care of our providers. I'm very excited and looking forward to all the pitches today. Thank you.
Awesome. Thanks so much, Kathleen. And hi, everybody. My name is Linda Benton, and I'm with Johnson & Johnson. And I think I have the best job in the company in that I get to represent how J&J has supported and advocated for the nursing profession for literally 125 years, which is, of course, the key reason why we're here today, again, as one of the sponsors of this event. I was just thinking about it in my head. I think the first hackathon that we sponsored with SONCL was actually 3 years ago before the pandemic, and I can't just take in all the changes and all that we've learned in this process. So congratulations to all of you on the call today who've been part of this process. You know, of course, we've been able to see the pitches that you're all about to see, and so impressed, so amazed again by the innovation that nurses bring to healthcare every day. So very, very proud to be a part of this today. If you're wondering what J&J is doing in terms of how we're supporting nurses today, if we go to the next slide, I'll give you a quick review of that. And that really what we're all about today is working with our partners to attract and strengthen an innovative, thriving, and diverse nursing workforce empowered to transform healthcare, which of course is the very reason why we are here today. And notice I didn't use the words recruit and retain, and that was very, very intentional. And that we spent a lot of time at the beginning of the year thinking about our strategy and what we wanted to do. And to us, the words recruit and retain, which are used in so many different publications and so many websites and social posts on a day-to-day basis, to us feels a bit transactional. And we want to go bigger. We want to think bigger. We want to support bigger because we think there's an opportunity to do this right, that where we can attract the nursing workforce, where you want to go to work, where you're going to a place and a work environment where you can really grow and thrive as individuals. So we'd like to move beyond the transactional language to that more inspiring language that we think is very, very possible. And again, when you think about some of the ideas you're going to hear today. 3 key areas where we're supporting today. One is we're always a passionate advocate for the profession through advertising, through podcasts, through going to conferences. We're also obviously working to support a workplace culture where nurses can thrive. And of course, this event is a great example of that, among other things that we're doing with nursing leadership programs, fellowship programs. And last, but certainly not least, but very importantly, we're working to diversify the nursing workforce and strengthen readiness to practice, because we believe very strongly that the nursing workforce should be able to mirror the communities that they care for. So there's a variety of things that we're doing there each and every day to support that work, from scholarships to a CNO Academy to a website, as well as a whole learning series for diverse nursing students. So again, really thrilled to be here with you all today, and I'm going to turn it over in just a moment to one of our really critical sponsors. I want to introduce Kasia Laskowski, who's the Executive Director of Thrive Global Foundation. And the reason that we're thrilled to have Kasia here today is because it's through her work that we were able to support the grant funding that has been made available to the awardees today. So I'm going to turn it over to Kasia to speak a little bit more about that. But then again, thanks to Kasia for your support of this important event.
Thank you so much, Linda. It's such a pleasure to be here. As Linda mentioned, my name is Kasia Laskowski. I'm the Executive Director of the Thrive Global Foundation, which is the philanthropic arm of the behavior change technology company Thrive Global, founded by Arianna Huffington in 2016 to end the stress and burnout epidemic around the world, how akin to some of the topics we focus on here today. I come to this work through our partnership with Harvard T.H. Chan School of Public Health and the Creative Artists Agency, which founded First Responders First at the beginning of the pandemic to care for our caregivers. First Responders First takes a whole human approach to healthcare workforce well-being and really tries to not only focus on basic protections and provisions, which we did at the very beginning of the pandemic, but also look at some of the emotional and mental needs of healthcare workers around the country. Through our work with First Responders First, which has evolved greatly over the last 2 years, our latest campaign is All In Wellbeing First for Healthcare, which takes a systems approach to this work. What we found when we were first starting with some of the mental health focus and funding those different needs is that, as I'm sure it's no surprise to anyone on this call, the uptake and engagement of mental health resources is very low, even if they're funded, even if they're outside of traditional health insurance providers. And one of the reasons for that is that the culture of medicine, the culture of healthcare workers don't really encourage some of these resources to be taken advantage of. So through our work with All In Wellbeing First for Healthcare, which you can see here is a call to action by First Responders First in partnership with the Dr. Lorna Breen Heroes Foundation and these incredible healthcare organizations across the country. We really aim to, first and foremost, advance solutions that help to improve healthcare workforce well-being, which is exactly what we're doing here today. And then the second goal is really to dismantle some of the barriers that exist to allow healthcare workers to actually take advantage of some of the mental health and well-being resources that they so desperately need. We are so thrilled to be here amongst these incredible organizers, which have been a dream team to work with. Alongside all of these incredible finalists, we're just offering you our congratulations for making it thus far, and our judges, and just offer our gratitude and look forward to hearing all of you. And I'm passing it over now to Marion Leary.
Great, thank you. Well, hi everyone, I'm Marion Leary. I am the Director of Innovation at the University of Pennsylvania School of Nursing, and I have the great honor of introducing our judges for tonight. Next slide, please. So we have an illustrious group of people who are going to be scoring our finalists. Rear Admiral Aisha Mix from the Public Health Service Commissioned Corps. Dr. Julie Kennedy Alert from ECU Health. Dr. Shekhar Saxena from the Department of Global Health and Population at Harvard T.H. Chan School of Public Health. Dr. Christopher Bao from the National Institute of Nursing Research. Dr. Gay Landstrom from Trinity Health. And Dr. Omar Latif from Rush University Medical Center. Thank you all so much for being with us tonight and for providing what I'm sure is going to be some great questions and feedback and conversation with our finalists.
Hi, and Kathleen's serious about that. It's great to be here. Thank you guys so much for your time and energy into this, and we're really excited to get going. So without further ado,